In Syria, the closure of schools because of the coronavirus pandemic is affecting far more than how children learn. It's also making it much harder for them to eat.
We estimate that around 368 million children around the world are being affected at this moment because they're not receiving school meals because their schools are closed.
The UN World Food Program and other humanitarian groups are doing what they can to continue distributing food for the Syrian children and their families.
In many cases, these are the poorest families that really depend on the fact that their children are going to receive this meal in school.
But getting much-needed supplies to vulnerable populations is posing a challenge. Travel restrictions and border closures are making it much harder to deliver aid. While workers on the ground in refugee camps like Kakuma in northern Kenya are introducing new physical distancing measures to protect people against the spread of COVID-19. In Cox's Bazar, Bangladesh, where around 1 million Rohingya refugees live, physical distancing is nearly impossible. Humanitarian agencies, however, say they are trying their best.
In the delivery of the humanitarian assistance itself, we have to be very, very careful in ensuring that we don't become part of the problem, but at the same time that we are responding to people's needs and hopefully preventing as much impact as possible in places like the camps in Bangladesh, where there are the most vulnerable people in the world.
It's not just the threat from COVID-19 causing concerns.
Humanitarian operations that are already happening before the COVID-19 outbreak need to continue. There are people who desperately need that assistance, and those operations are there for a very good reason, because people depend on it.
At a time of growing uncertainty, for aid workers, one thing is clear. The obstacles they face in delivering help are already great. They will likely become greater. Mohammed, Jamjoom, Jazeera.